One thing that you cover is how to make informed judgments about treatment's validity. Can you tell us a little bit more about how to assess what treatment may be right
Sure.
for oneself?
Yeah, I think the issue is probably less about a particular treatment's validity than in figuring out which treatment is best for your personal version of this cancer. The problem with prostate cancer, and I think with a lot of other cancers, is that there's nothing at all what you could call standard or universal about the cancer. So far, for example, researchers have identified 27 different versions called genotypes of prostate cancer. Some of them are aggressive, but about 75% of prostate cancers are very slow growing, and there's always the threat, though, that one of them could turn aggressive in the future. So the problem, the medical problem, is that we don't know yet which cancer each of us might have, and therefore what might be the best or optimal treatment. Now, there's lots of research going on that's looking at the genetic roots of prostate cancer, and I think in the future, treatments will become increasingly customized, if you will, to a man's individual situation. Right now, though, as I found when I was diagnosed, and I've certainly found in talking to men who've just been recently diagnosed with prostate cancer after that, there's the almost mind-numbing variety of ways of treating prostate cancer. There's surgery, radiation, seeds, hormone therapies, and each of those has their own subspecies, if you will, such as robotic versus laparoscopic surgery, electron beam versus proton beam radiation, and so forth. And everybody's arguing for one or the other. None of them actually, in reality, at least as demonstrated by clinical trials, stands out as being clearly superior to any of the others. And every one of them has side effects, or what I prefer to call after effects. Not to mention that, for example, in the area of proton therapy or robotic surgery, there's a lot of marketing going on as well, which may or may not be to the patient's benefit. So when you go in for second or third opinions, you'll almost always find that the urologist, who's a surgeon, recommends surgery, the radiation oncologist recommends radiation, and so forth. Yeah, they're all very sincere, but it's not really that helpful. The final decision about which treatment to choose is always going to be up to the patient, to the individual. So I think that our task as men who've been diagnosed with prostate cancer is at once to be clinical or scientific. In other words, you basically have to do the best you can, educate yourself, make the best informed choice that will probably lead to the best possible outcome for your particular cancer. But along at the same time, it's really essential that you also consider the personal side. Which treatment is going to be the most comfortable one that you can live with? I guess another way of saying that is, which is the treatment that's most likely to give you the least regret going forward? Because you really only get one shot at it. So it's a difficult, yes, life-changing decision, but in the end, the valid treatment is the one that you basically undergo and then live with.